This lecture covers Part 3 of Unit 3 for EMS 189 on the skeletal system, which can be found in Chapter 3 of your AAOS Anatomy and Physiology textbook. Let's begin by recognizing that there are two divisions to the skeletal system, the axial and the appendicular. The axial includes the skull and vertebral column, where the appendicular is the extremities, the arms and legs. The portion of the skeletal system that runs through the length of the torso is the axial. Including the skull, it's the top of the axial skeleton. It consists of 28 separate bones. There's 3 anatomical groups of bones: the auditory ossicles, the cranium, and the face. Remember that there are sutures in the skulls where the joints come together. There's a sagittal suture, the coronal suture, and the lambdoid suture. These sutures are not fused in young infants, and this is where the fontanelles come into play. There's an anterior and posterior fontanelle, which can be felt on pediatric patients. The fontanelles are soft spots in the skull of a newborn and infant where the sutures of the skull have not yet grown together. By the time the child reaches age 2, the suture should have solidified and the fontanelles closed. The cranium is made up of 8 bones that encase and protect the brain: the frontal, parietal, occipital, which includes the foramen magnum. The foramen magnum is a large hole that the superior part of the spinal cord passes through and attaches to the brain stem. The sphenoid bone, the ethmoid bone, and 2 temporal bones. Here's a good graphical depiction of how those bones are laid out on the cranium. The temporal bones, there's 2 temporal bones, the mastoid process and the external auditory meatus. The mastoid process is the cone-shaped section of the bone. It's a site for muscle attachment. The auditory meatus is the opening that leads to the ossicles and inner ear structures. The ossicles, of course, are the 3 small bones in the middle ear. The styloid process are the bony protuberance made up of several long, slender, and pointed bones that project downward and forward from the temporal bone. It's located below the meatus. The facial nerve supplies sensory and motor nerve functions to the face. The floor of the cranial vault is actually a pretty complex structure. This is made up of a thin, flat bone. It's viewed here from above from the superior aspect. The cranial vault is divided into 3 compartments: the anterior, middle, and posterior fossa. The crista galli is the point of attachment of the meninges. Remember that the meninges is the 3 layers of membranes that surround the brain and spinal cord. The 3 layers of the dura, the arachnoid, and the pia. The cribriform plate is the horizontal bone that is perforated with numerous openings for the passage of olfactory nerve filaments from the nasal cavity. The foramina are small openings or perforations or orifices in the bones in the cranial vault. The nasal cavity is a chamber inside the nose that lies between the floor of the cranium and the roof of the mouth. The sella turcica is a saddle-shaped depression in the middle of the sphenoid bone between the anterior and posterior fossa. Remember that the pituitary gland resides in this area. The pituitary gland is an endocrine gland that directly or indirectly affects all body functions. It's known as the master gland because of its inherent link between the autonomic nervous system and the endocrine system. When the mandible is removed, the base of the skull appears amazingly complex. It's very complex to consider. Most of these bones are fairly thin. Notice the foramen magnum in the center. This is where the inferior portion of the brainstem or superior portion of the spine goes through the skull. Notice all the several openings for all of the nerves and vessels in the base of the skull. A hard palate is the top of the mouth, or the anterior part of the palate, formed by the portions of the maxilla and the palatine bone. The zygomatic arch is a bone that extends along the front of the skull below the orbit, which forms the zygomatic process, or your cheekbone. The facial bones, of course, serve to protect the eyes, nose, and tongue, and provide attachment points for the muscles that allow for chewing. The orbits are where your eyeballs reside. They're cone-shaped fossa that enclose and protect the eyes. In addition to the eyeballs and muscles that move the eyes, they also contain blood vessels, nerves, and fat. Orbit fractures can occur typically as a result of assaults, sometimes as a result of motor vehicle accidents. It can result in a blowout fracture, which is a fracture of the floor of the orbit and leads to the transmission of forces away from the eyeball and towards the bone. These can be very devastating for the patient. The nasal cavity is composed of the portions of the frontal nasal sphenoid, ethmoid, and inferior nasal concha, maxilla, palatine, and vomerofacial bones. The septum, remember, is separation between the nostrils. It's located in the midline of the nasal cavity. The septum is actually only bony at the superior portion. The inferior portion is cartilage. The sinuses are cavities or hollow spots within the skull. There are several sinuses in the facial bones. It decreases the weight of the skull and provides resonance for your voice. The contents of the sinuses drain into the nasal cavity. I'm sure we're all familiar with what happens when the area and membranes within your sinuses become infected. Here's a graphical depiction of where the sinuses lay in the facial structure. The mandible is the large movable bone comprised of the lower jaw and containing the lower teeth. Two perpendicular rami joint the body at the nearly right angles. The anterior coronoid process and the posterior condyle are found at the top of each ramus and are separated by the mandibular notch. The TMJ, or temporomandibular joint, is the location where the posterior condyle of the mandible articulates with the temporal bone and allows for the movement of the mandible. This joint is subjected to tremendous forces during normal activities of life, and then especially when eating and chewing. This is a typical joint that is problematic for geriatric patients as bone tissue begins to degenerate with age and become less dense. Oftentimes, injury or chronic problems with the function of the TMJ is the first step for many geriatric patients to wasting away. And it's been the TMJ has been a point of great research over the past couple of decades, trying to solve this problem for the geriatric population. The hyoid bone is interesting because it really has no point of attachment to any other bones. It is a point of attachment for many important neck and tongue muscles, but essentially it floats. It's in the superior aspect of the neck just below the mandible.